Hello. A lot of women come to us asking about breast enhancement procedures, asking for options of what can be done to increase the size of their breasts. There are two ways how we can increase the size of the breast. One is a fat grafting surgery, in which we harvest the fat from certain areas of the body of a woman where they want to lose the fat, and this fat is then treated and grafted to the breast to enhance the size of the breast. This is a good technique since you get an autologous tissue to augment their own size of breast, but the problem with this technique is you can only increase the size of breast from half to 1 cup size. Now, if a woman desires a further increase in size of breasts, say from A cup to C cup or D, or changing of more than 1 cup size of breast, then the best option available for them is breast implants. Now, breast implant surgery is one of the more commonly done surgery for women across the globe. It's an absolutely safe surgery if done properly by a good surgeon at a good center. If you are considering a breast augmentation surgery, this video is for you because we will be discussing a lot of finer nuances breast augmentation surgery, especially implant based surgery. I am Dr. Rajat Gupta, a board certified plastic surgeon working in Delhi, having experience of more than 10 years in cosmetic surgery. So let's talk about breast augmentation today. Now, when we talk about breast augmentation, one should not jump upon the decision of size of breast implants. There are several other things which needs to be discussed. What are the approach to the breast implants? What plane in which you want to place an implant, and what impact the choice of plane of breast implant placement will have on your final aesthetic result. And then we talk about what are the different types of breast implants, what are the shapes of breast implants, how do we decide upon what a woman wants, what size do they want, how will they look after the surgery. All these are pertinent questions regarding a breast augmentation consult. So let's start with approaches of breast implant surgery. So there are essentially three approaches in which a breast implant can be placed in any female. Either you can give a transaxillary cut, in which the incision is hidden in the armpit, or you can give a periareolar incision in which the incision is at the border of areola, or an inframammary incision in which the incision is beneath the breast. Let me show you how these incisions look. Now, talking about different approaches, this is an incision which is made in armpit. This is the periareolar and this is the inframammary. Now let's see what these approaches are. This is an armpit approach in which the incision or the scar is hidden in the axilla. This is a periareolar approach in which the incision is at the edge of areola and the normal skin. And this is inframammary incision in which the incision is kept beneath the breast. All of these options have their own pros and cons. What I recommend to every patient is discuss each one of these options with their respective doctors in much more detail and then decide about the best approach or a plan for every individual. I, in my practice, most commonly use inframammary incision because this incision is always hidden under the breast and is even not visible if the patient is standing naked. So this incision is a much more direct approach to give you a breast implant. Having said that, the other approaches also have their own advantages in certain indications, and I tailor the approach and the decision depending upon each individual's needs. Now let's talk about what are the different planes in which a breast implant can be placed. Essentially, there are two planes in which a breast implant is placed, either above the muscle and behind the breast, or behind the muscle. Now, over a period of time, behind the muscle technique has slightly modified into what we call as a dual plane. So let's see what is a dual plane technique and what is a subfascial technique or above the muscle technique. If you see in this diagram, The implant is placed behind the breast and above the muscle. This is the muscle. So this is subfascial technique. And in this diagram, you can see the implant is partially covered by a muscle and the breast tissue. Hence, this is called as dual plane technique. Now, what are the impact of this technique on your overall aesthetic result? This technique will give you a result like this, and this technique will give you a result like this. I hope you can appreciate the difference in the shape of the breast. These are some finer nuance because this technique gives you a much more fuller look in the upper pole, and this technique gives you a much more natural look. Also, it is recommended that one should do this technique if the tissue thickness in the upper pole of a female is less than 2 centimeters. Because if you put a breast implant in a thin female just behind the breast tissue and the tissue is less, the implant will show and it will look unnatural over a long term. One should always discuss what plane of breast implant placement they want and what impact it will make on their aesthetic result with their respective doctor. Now let's get back to the third important point in breast implant surgery is type of breast implant. If you can see, I have 3 different types of breast implants in front of me. This is actually a smooth implant. If you see it, it's actually transparent. You can see through this implant. This is something called as nano-textured implant. This is actually translucent. And this is a textured implant where you can see the texture is very rough. Now, all of these implants are high cohesive gel implants. What does this mean? This means that implants retain their shape because of high cohesivity of the silicone gel used inside. In fact, whatever you do with these implants, they retain their original shape. It is said that even if you cut the implant into pieces, the silicone will not flow anywhere. It will retain its shape in which it has been designed. Now, what are the different types of textures and what they do? Now, I would like to introduce you to a problem with breast implant which has been in a lot of discussion over the last few years. That is called as breast implant associated lymphoma. Now, this is a type of benign cancer which has been seen in few cases of breast implants, very few cases, but all of these cases has been reported after textured implants. Now, this has made sure that textured implants have gone out of favor of plastic surgeons. I was not using these implants, thankfully, for the last 6 to 7 years. I have always been a very good fan of smooth and nano-textured implants. These implants are safe, have no issues. There has been no reports with any problem with these of any kind of health hazard. Let's talk about another important advantage of these implants. These are, as I said, 7th generation high cohesive gel implants. What does this mean? This also means if you hold the implant like this, I want you to see this in a profile view, you would see that implants automatically shape in a much more natural shape. They are not rounded on the top. On the other hand, if you go back to an old generation implant like this, you would see if you hold like this, it retains the round shape, and this is the position it is placed inside the body. So it retains the round shape, which is slightly unnatural. The smooth implants or nano-textured implants, if you see, fall into a nice shape of an anatomical. This looks much more natural, and since these implants have come which fall into a shape in which you get a much more natural result, and especially if you do with the dual plane technique, these reasons have actually made sure that we use round implants with these properties in most of the patients. Anatomical implants are not used these days because the anatomical implants had their own problem to begin with. So, this is what we wanted to discuss with you about the implant. The next issue, which everybody talks about, is the size of implant. How to decide different size of implant. So, traditionally, every surgeon was doing this technique of putting different size of implants inside a woman's bra and asking them to look in the mirror and see and decide what size would they prefer. Now, this has been a technique which has been done everywhere across the globe, but it has its own policy because the implant is actually not going beneath the skin, it is on the skin under the bra. And it gives you an idea, but it's not very, very accurate. At the same time, the surgeon would always assess you for your shoulder width, for your pelvic width, will discuss with you what your desired goals are, and then decide about different size of implant. Now, in our clinic, what we use is a 3D simulation software by a company called Crisalix. Now, what we do with this, we take the pictures through an iPad, and this scanner converts your image into a 3D image. What then we do with the use of software, we put different sizes of implant on your own body image, and you can see what different size of implant will look good on you. This has improved the patient satisfaction as well as they get to know what to expect after the surgery. The breast implant surgery is a daycare procedure. The patient comes to hospital in the morning, gets their surgery done, and go back home in the evening. It's a reasonably comfortable procedure, and the way we do it is we call it as a flash recovery breast augmentation. That means the patient is back to their daily routine activities from next day. There is no rigorous precautions. They can go back to their office the next day, basic antibiotic and analgesics for first 5 days, and they can resume their cardio exercises after 1 week. One has to make sure that they avoid heavy weightlifting exercises over their shoulders for 6 weeks and wear a sports bra for 6 weeks. These are the 2 precautions which I advise to my patients, and rest, they are very happy to go back to society with their new form and shape from the next day. I've tried to answer most of the common questions asked by patients regarding breast implant surgery in this video. If you have more questions, do write into us and I'll be happy to help you. Always make sure that you visit a board certified plastic surgeon only to get any of the cosmetic surgeries you want. Thank you.